human papillomavirus vaccine, which I'll call HPV for the rest of the afternoon. So HPV, we're not getting into girls much more than half the time once, and less than a third of all girls in New Mexico are getting HPV vaccines, all 3 doses. We're doing still worse on HPV vaccines for boys. The number of boys who completed the 3 doses of HPV vaccine were so small in 2012 that it couldn't be measured. Now, is this a permanent state of affairs? Are we doing the best we can? I think the answer is no. If you look here at the spot where the United Kingdom is, they're over 80% in getting HPV vaccine into adolescent females. You might be able to guess why that is. The reason that they do so well, I think, is that they give it in schools. So that's an indication that those of you who are out on the phone might be part of the solution to this problem, not getting enough of the vaccine to kids. The British stiff upper lip, as they say. The British don't seem to have as much difficulty talking about sex. Well, or maybe they do. If you look at this quote from a journal that I was looking at the other day from the Lancet, earlier this month, the President of the United Kingdom's Faculty of Public Health made the surprising claim that adolescents have sex. That may not surprise some of you in the high schools and middle schools around New Mexico. In other words, in the United States, we're not doing very well at getting vaccines into kids. The rest of this talk is about how we can do better. So I want to show you a few videos, and I hope that this will work. This one is, you can see the Julio Iglesias lookalike in an Indiana classroom. And I think you probably aren't going to be able to see him singing, but you can hear the dialogue. I say to all of the girls that I love in this world, there is one thing that can keep us apart. Consuela Maria, I beg you come near us as I speak this word.
Right now, did you eat those?
No quiero que te enfermes.
They will have to be performed on a PC, as the terminals are not suited for streaming content like that. So perhaps the PC and the Nurse Call Center, Conference Center would be best. So I'm going to ask him, I think,
but before we can discuss it, we must agree. You're welcome to my world, my friend. But if you can get the cusses, you can't have me. Cause the boyfriend who has whooping cough can't take me out at all. I wanna dance and talk and sex and look good at the mall. Get the Tdap shot. Okay, enough about Tdap for the moment. Here's another one, and again, I'm afraid we're not going to be able to see the video, but I'd like to play a little bit of the audio anyway. And here we are.
You might live, you might die. Who knows? I didn't know what it was. And it destroyed me. Physically and mentally, emotionally, in every aspect possible. We had no clue.
I didn't know anything about meningitis. Knew nothing.
As I understand it, is a disease that can attack the brain, the spinal cord, or different body parts. And it's been proven that when you live in close proximity, the potential of contracting meningitis is a lot greater. We got to A&M, he was a junior, and it was unbelievable how many people responded to that kid and how many people absolutely loved it.
I'm going to stop it there because without the pictures it doesn't make a lot of sense. But what you're looking at on the screen there is Jamie Shanebaum, who is a Texas, now 20-something, who had meningococcal meningitis in the first year of, at the University of Texas, who lost her legs, lost most of her fingers, and is now a strong proponent of getting the vaccine to avoid the problems that she had, or the other boy that they were talking about who died from the disease. So while meningitis is not a very common disorder, it is a terribly severe disorder. The vaccine is required by many colleges and is recommended for everyone. So unfortunately, this is another one we're not going to be able to see, I don't think.
Papillomavirus. Now that might not sound too fascinating, but believe me, it is. This is the story
We're not
that
seeing
involves parts of the body we don't often talk about. Human relationships, warts, our immune system, and unfortunately, cancer. So there will definitely be TMI. Parts of your body we don't often talk about. Human relationships, warts, our immune system, and then
this is a very nice video of somebody drawing as he's talking about the human papillomavirus vaccine. And it's great. It goes on for about 8 minutes, which I wasn't going to show you anyway, all of that. But he talks very well about the disorder that it prevents, cervical cancer, and about the ways we have of preventing that. One mistake he makes, I think, and we'll come back to this later, is that the first thing out of his mouth or out of his pen is that this has to do with sex. Well, it does have to do with sex, but that's not the first thing that we should be talking about when we're talking about HPV vaccine. This is a vaccine to prevent cancer. And that's what I say every time when I'm presenting the vaccine to the parents of the young teens or preteens who come to see me, and it's time to give them their HPV vaccine. So Mike Evans, you're great, but that's a mistake in my view. The ACIP, the Advisory Committee on Immunization Practices of the CDC, recommends that all preteens and teens, both boys and girls, get the vaccine. Well, if nobody wants cancer, meningitis, or pertussis, what do we have to do to influence them to get them immunized? And who do we have to influence anyway? Do we have to influence the parents? Do we need to talk to the preteens and teens themselves? Do we need to talk to physicians, nurse practitioners, physician assistants, and nurse practitioners in school-based health centers? I think the answer is to all of those is we need to talk to all of them about it. So here's a little bit first about parents. What do parents really want to know about vaccines? Well, they want to know that vaccines are safe, that they're effective, that they're affordable, and that their child will be at risk if he or she doesn't get the vaccine. First of all, with regard to safety, although if you Google vaccines at home, you'll find that the first 10 things that come up are some crazy websites that say that vaccines are the worst thing since Hitler. There is a very robust vaccine safety network in the United States that consists of these three entities that I'm going to talk about for just a minute. Some of you may have already used the CDC's website to find out about vaccines. Some of you might have reported vaccine-associated adverse effects to VAERS, but probably most of you don't know about the Vaccine Safety Data Link. If you report to VAERS, you're doing a good thing, and you and many other people do report to VAERS, but that is a passive system where what is reported is entirely up to the parent or the physician or nurse practitioner who is doing the reporting. Once VAERS gets reports on something, for example, the outbreak of what seemed to be neurologic disease in southeast New Mexico many years ago when HPV vaccine comes out, Once that gets reported, then it goes to the Vaccine Safety Data Link, which is a series of 8 different HMOs that have very strong electronic medical records, and that can look at what happens within a month, or a week, or a year following a child's getting a particular vaccine. And so they do that. And the project works so that within a couple weeks of submitting a question to Vaccine Safety Data Link, they get a very good answer as to whether there really is a link. Of course, with the HPV vaccine, there is no link between neurologic disease or death and the vaccine. And that was proven through very careful work at the Vaccine Safety Data Link. So the vaccines that we have available are safe. Are they effective? Well, when was the last time you saw tetanus? Probably you, like me, have never seen it. I have seen diphtheria, but I'll bet nobody listening has. I last saw it in Gallup in 1970. So you're not likely to see that again, thanks to vaccines. Have you ever seen meningococcal disease? Well, probably not, because it's fairly rare, but what do you think Princeton University and the University of California, Santa Cruz did when they had outbreaks of meningococcal disease? They went to vaccines, and they vaccinated the whole student body at those 2 places. Everybody was very willing to do it because the vaccines are effective. We can talk more about those outbreaks if you're interested later. Also, with respect to the HPV vaccine, the HPV vaccine can prevent about 90% of genital warts and about 70% of cervical cancer, as well as much of anal and penile cancer and oral cancer as well. It also prevents the acquisition of the HPV types that cause these problems, so they can't be passed on to other people. And in fact, that's proven very nicely by this study that was done in the United States between 2003 and 2010, both just before the introduction of the HPV vaccine and after. So the black bars are before and the gray bars are after. If you look to the left side of the slide, you'll see that the vaccine types 16, 6, 18, and 11 have been reduced by more than half in the whole population. Now that's the whole population. That's not just the ones who got the vaccine. So there's a herd effect. All of us are benefited by the fact that we're getting the vaccine into some, and hopefully more, of the girls in this case, but boys too, pass on the virus to other people. There's some other interesting things about this slide that I could tell you about, but I'll skip it for a moment and we can come back to it if anybody has questions about it. Are these vaccines affordable? Well, in the states that surround us, and in most of the, 44 of the states in the country, the total private sector price for all of the vaccines on the list, not including influenza, up through age 18, was about $2,136 when I last looked in March of last year. Probably a little higher than that now. You know what the cost is now in New Mexico? Well, it's zero, because up to age 19, you can give any of these vaccines on the list free to the patient. There is a vaccine administration charge in most clinics, although we are told that we must avoid charging for it if a patient can't pay for it. So they certainly are affordable here in New Mexico, and that's a very nice thing about living here in this state. Is your child at risk if she or he doesn't get the vaccine? Well, I think the answer is clearly yes. And we all know that for the last 2 years or so, New Mexico has had an increase, a big uptick in the amount of pertussis in the state, in teenagers as well as in all other age groups. It's a little bit less this year so far, and I hope it stays down, but we are at risk. In addition, we're at risk for cervical cancer. Those of you of the female persuasion are at risk at about the same rate as in the United States as a whole. This is New Mexico tumor registry data for the 4 years preceding 2010, and you'll see that Hispanics in New Mexico have a slightly higher rate of cervical cancer than in the country as a whole, and New Mexico non-Hispanic whites and Native Americans are a little bit lower than the national average. But look at the bottom part of the slide, and you'll see that New Mexico Hispanics and New Mexico American Indians have a much higher rate of dying from cervical cancer than people in the United States as a whole. So definitely people are at risk here in New Mexico of contracting the viruses that cause all of the cervical cancer in the state. And the same is true for penile cancer. Penile cancer is about half as common as cervical cancer, although it doesn't lead to mortality very often. It's also true that people are at risk because of their behaviors. And this slide shows you that about 6% of U.S. students have had sex by the time they started in high school. And the number who had sex increases gradually but fairly quickly from the time they start high school till the time they end high school, so that a majority of both boys and girls have had sex before they get into their senior year in high school. That means that they are exposed to somebody else who very likely has HPV. And that's a reason why we should be giving the vaccine before the time that they're likely to encounter the virus. The vaccine is effective against all those types that you've never had contact with, but the vaccine is not effective against types that you already have on board. If you look at the acquisition rate of HPV infection, that is very rapid. These were young women at the University of Washington who had not had sex before they started the study. And you can see that about a third of them had at least one HPV infection by the time they'd been sexually active for a year. And about half had been exposed to at least one HPV type by the time 3 years had passed from the onset of sexual activity. So yes, we are at risk as soon as we become teenagers, pretty much. Well, moving on from the parents, let's see about how you convince the kid. And this is where I wanted to show you those videos. Do you think that the scare tactics of the second video are effective? The girl lost her legs and her fingers to meningococcal disease. Do you think that the cute video like Julio Iglesias and his friends talking about Tdap are effective and work? I don't know the answer to that question, to either of those questions, as a matter of fact. I guess my main point is that I'm not sure how important it is to convince teens that they need to get vaccines. Teens sort of think they're invincible. They think that they'll never get a disease, so why should I get a painful shot? So there they are, saying, I don't want the vaccine. But I say to parents, just say yes. This is something where the parent should determine, just as the parent doesn't let her child drive drunk or without a seatbelt. Parents should say, you get the vaccine. What can you do in a school-based health center? Well, first of all, I think you need to be sure that you agree that these vaccines are important. And then you need to say so with authority and with conviction. You need to let parents know that their children are at risk, that we want to maximize the fact that cancer prevention of meningitis, prevention of whooping cough are very important. We want to minimize, perhaps, the fact that at least the HPV is acquired through sex. And we need to get them back from whatever they're doing to get their second and third doses. If you look at this list of possible ways of presenting vaccines, here are some options. Also have these other two vaccines which you could get. The Tdap is the one that's required. Many teens also get these other two vaccines. I recommend these vaccines strongly. My 12-year-old grandson has already had his. A lot of girls have gotten this vaccine, not so many boys. I recommend these vaccines to all of my teen patients, boys and girls. So what do you think would be most effective? Well, I think it's this one. And I can say that my 12-year-old grandson and now my 11-year-old granddaughter have had their HPV vaccine because I believe strongly that they're important. I'd probably throw my daughters out as disinherited if they didn't get their vaccines for their kids. Maybe some of you don't have children that age yet, grandchildren that age like I do, and so then the last of these would be a reasonable option. So I recommend these vaccines strongly to all of my teen patients, boys and girls. Here's a list of key barriers to HPV vaccination, and this is one advantage if you're looking at this on a screen rather than in person, because the people here in the room have a real hard time reading all these possible barriers. But among the barriers are particularly parents' attitudes and concerns regarding HPV vaccination. They're concerned about price, but that's not an issue here in Mexico, for example. They don't know that their children are at risk. They wonder why you don't wait until later when their child's going to have sex. And of course, parents don't think their child's ever going to have sex before they get married. It's all those other kids who do. They like to wait. So let's just wait. Parents don't get enough recommendations from others. They don't know very much about HPV vaccine or about the disease itself. They don't think that it's a problem with males. They don't know that males are the ones who transmit it to females, for one thing, but also that males are able to get HPV-caused diseases themselves, which are not pretty diseases. So these are some of the things that stand in the way of our getting that HPV vaccine rate up. So here are the data again. If you look at those data, they're not anything to be very proud about. And if you look at the distance between the first HPV in girls and the third HPV in girls, and the first in boys and the third in boys, you'll see that we have a long way to go before we complete the series in those kids who really need to get the vaccines. Again, the United Kingdom does a whole lot better than we do, but we're not doing very well at getting them back. We're sort of wasting vaccine if we're only giving a single dose to girls or boys. So here are some ways to remind kids to get their second and third doses. In New Mexico, about 98% of practitioners are using Gardasil as opposed to Cervarix, although Cervarix has some things like that, which you see on this slide. So on your left is a folder that is given to patients at the end of their visit saying, you need to be reminded about a second and third dose and write in the dates in which they should come back. On your right is a gadget, and I promise you that these gadgets work. We've tested them out, but they're hard to test out because what you do with them is you set them at the time you give the first dose, and then 2 months later, suddenly, flash, 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 the red lights come on, and you are encouraged to make an appointment and go in for the second dose. And then another 4 months later, and 6 months after the first one, the flashing light goes on again, and it's time to go back for the third dose. So maybe those work. These things are available. The New Mexico Immunization Coalition has other tools on its website, and the New Mexico Medical Society also has tools to help you get kids back for subsequent doses. There's also a second dose of meningococcal vaccine that is recommended just over the last couple years. So 3 to 5 years after the first dose, a second dose should be given if the first dose was given prior to 15 years of age. And this is required by many colleges and universities, including those in Mexico. So you'll be getting requests for those as well. So I want to talk for a moment about influenza. These are reasons why your school should skip flu. Oh, I guess I misspelled skip. No, I didn't. That's SKIP with two I's stands for the School Kids Influenza Immunization Program. And maybe some of you in schools around New Mexico are involved in SKIP with two I's. Maybe in your school you're giving flu vaccine in the school, as we did to about 50,000 school kids in New Mexico this year. What this graph shows you is what happened in Japan during a period when Japan required school flu vaccines. You can see that the death rate from influenza in Japan fell markedly during the years between about 1962 and 1987 when flu vaccine was required. After, for some reason, Japan decided not to do that anymore, you can see the rates starting to climb again at the end of that period. In the United States, we haven't seen any similar markings because we haven't been as good at getting flu vaccine into kids as they did in Japan during that period of time. Here's some data on your left from Houston and your right from Albuquerque, showing that influenza does affect school absenteeism. So to go through all those complex graphs on the left side of the slide, you'll see that that emergency room visits, pneumonia admissions, and mortality from influenza all go up at a certain point in the year. Interestingly enough, in the top frame of that slide, you'll see that the school absentee rate increases markedly, but a couple weeks before the peak in other aspects of influenza. The reason that this seems to be the case, we've shown the same thing in New Mexico, as you'll see on the right side of the slide, is that kids are great incubators for disease. You probably knew that anyway. If you have kids in preschool, you're going to get sick more often than people who don't have kids in preschool. Well, the same is true for school-age kids in influenza. So both in Houston and in Albuquerque, we've shown that the peak of absenteeism from school, presumably due to influenza, precedes the peak in influenza isolations. So another good reason to not skip the flu, but to apply SKIP to the flu, is to skip the disease that occurs throughout the community once kids are spreading it amongst themselves. In case you're not convinced, here's some information about the death rate due to influenza. The death rate due to influenza is estimated throughout the country to be somewhere around 21,000 people a year. Now, that isn't a lot of kids on that group, but 21,000 people makes it by far the most important infectious disease in the United States as far as causing mortality. And if you look at kids, you'll see that every year there's somewhere between, in this case, 35 and 171 deaths due to influenza per year in children under the age of 18. That's not nearly as many as old people who die of the disease, but it's another reason why we'd like to prevent influenza. So if the schools in which you're working are not participating in the statewide school kids influenza immunization program, we can tell you how to get on it and do it again, or do it for the first time next fall. Well, to recap, and then I'll stop and answer questions, I think it's very important that you be emphatic and positive about your recommendations for these vaccines. Get your whole office, everyone from the people at the front desk to the teachers and the school nurse, to support these vaccines. You need to avoid missing opportunities to vaccinate. Perhaps that's more a problem for the practicing physicians than it is for you, but when kids come in for a cold or they come in for their sports physical, that's the time to look and see if they are needing vaccines, team vaccines included. So avoid missing opportunities because you may not get that kid back. At our office, we check vaccines at every visit, and unless there's one of those rare contraindications to getting vaccines, we push vaccines every single time a kid comes into our office. As far as getting back kids for their second and third doses, we can make reminder calls. Some offices will do that. Some will use those folders that I showed you. Some will use the flashing lights. And there's soon to be, out of the state health department, some information about how we might use texting to get information to parents about the time for the second and third dose. With regard to the vaccines that have more than one dose, remember that with no vaccines that we use in childhood, do you ever have to start over? So you haven't wasted the vaccine if the last dose was given 2 or 3 years ago. Go ahead and keep going on the series because the body remembers. And the final note here is don't forget influenza. If you look at cervical cancer, we hate to see the 3,500 deaths per year due to cervical cancer in the United States. But remember that there are 6 times as many people who die of influenza each year as die of cervical cancer. So we should be trying to prevent that just as much. So thank you to Envision for letting me use this pulpit. And to those of you out in the school-based health centers, thank you for listening in and for all the good work that you do. It's great to have you as colleagues, and now I hope I can be a colleague and answer some questions for you.
And while you're typing your questions, I'm going to try to get our audio to work so you can ask them live as well. So we do have one here. Does the efficacy of the HPV vaccine change if there are longer than recommended periods between doses?
Can you all see that? Can they all see the
They
question?
can see the chat, yes.
Okay. So the answer is to the first question, which has moved up on the screen. Philip Spears asks if the vaccine is less effective if more time passes than recommended between the first, second, and third doses. And the answer, as far as we can tell, is no. Of course, if you get the first dose and it doesn't protect you and you have sex and you acquire a vaccine, then, a virus, then the second dose isn't going to be effective against that particular virus. So it's good to get the vaccine in as rapidly as you can so that people are protected from the time of the third dose. The second question that Mr. Pierce asks is a very good one. Is parental consent required for HPV vaccine? And I was anticipating that question, so I have asked for legal advice on it, and I have to tell you that I haven't found legal advice on it yet. So the state immunization program is looking into it, and I have a professor at UNM Law School looking into it. The problem is that the law says in section 24.1.8, since I just was looking at this before I came down here, that we can treat adolescents confidentially for sexually transmitted diseases, but it doesn't say anything in the law about preventing sexually transmitted diseases. Now, of course, we hand out condoms, or at least in our clinic we do, without asking parents' permission, and I think that's to prevent disease. In this case, we just really don't know. So I hope to get back to you somehow after I get a legal opinion on this. And if the legal opinion says, no, you can't do it without HPV, or without specific parental consent, then I think we need to go to the legislature and get the law changed. So another good question here, is the HPV vaccine shown to be as effective for boys as for girls? And the answer is yes. The studies show that the antibody levels are as good in boys as in girls, and we assume that those antibody levels are just as effective against HPV virus in boys as in girls. Now, the vaccine hasn't been used in boys as long as it has been for girls, and so we'll be looking to see if penile cancer and anal cancer are prevented, as we are almost sure will happen if we keep giving the vaccine. What other questions do you have?
Going back to the question about parental consent, but that would only apply for kids over 14, right? If they're under 14, there's no law that talks about providing care for those kids, so they would need parental consent?
Well, good question. I believe that what the law says, and I was just looking at it this afternoon, so for mental health care, one cannot access mental health care without parental consent under age 14, with certain exceptions, but let's leave it at that. For sexual health, there is no age limit specified in the law. So whatever applies to older teens seems to apply to younger teens. It's just that I don't know what is the law. Can you please talk a little about the importance of SBHC sharing immunization information with other providers using NIMSIS, etc.? Well, first of all, I should just make sure to translate NIMSIS, or Nemesis as we used to call it, the New Mexico Statewide Immunization Information System, is a state resource that I suspect all of you know about and are using, but it's very important that we use it to make sure that we're using our resources well. Although there's no problem with giving excess doses of any of the teen vaccines, Tdap, meningococcal vaccine, HPV, they are pretty expensive, and it's kind of silly to hurt a child with a shot. I mean, it does cause pain for a moment, and to cause a cost to the system for a child who doesn't need the vaccine. That said, if you can't be sure that a child has gotten a vaccine, it is safe to revaccinate them, even if you find out later that they had already had that vaccine. The next question, has there been any documentation about whether or not HPV has been associated with throat cancers as well? And the answer is yes to that question. HPV has been associated with a large percentage, somewhere between 30 and 50% of throat cancers that are not associated with smoking. Smoking is the most important cause of throat cancer, but HPV is next. Now, if you'd asked the question, do we know whether the vaccine prevents throat cancer, the answer is it seems reasonable to assume so, but that study has not been done, and the manufacturers say that it's not going to be done for reasons that are a little opaque to me at this point.
I have a question about the pain associated with the HPV vaccine. I know that's sometimes a concern for some patients, is that they hear it's really going to hurt, or I'm going to pass out or something. Could you just address that?
Mm-hmm. I've heard people say that it's more painful than other vaccines too, and not having received it, I couldn't say. It is certainly true that there has been association of the vaccine with fainting, but teenagers faint when they get any kind of poke. My daughter faints every time she gets blood drawn, so it is a possibility. So what I should say next, McCain, I think, is after you give the HPV vaccine, don't tell people, or before you give it, don't tell them that it's not going to hurt, because it does. Any vaccine hurts briefly. And then have them sit down. Don't let them leave right out the front door and go off and drive away and faint while they're driving home. So the guidance from CDC is that after any vaccine, really, you should have the patient sit for 15 minutes and be observed. Any other questions about these or any other vaccines? Did you say pertussis rates are lower this year? Yes, pertussis rates are lower this year so far, and they were lower last year than they were in 2011 and 2012. So we're doing a little better. Whether that's natural fall, it was an unnatural 2 years where we had high levels, or whether we've actually done better at getting vaccine into people, I don't know. So we're doing better, but don't know why. California and Washington had big outbreaks in the years before New Mexico did, and they had a fall also after 1 or 2 years of very high rates. So it's a natural phenomenon, at least. The next question from Paula Thomas is, should we give HPV vaccine even though they are sexually active? And the answer is yes, definitely so. Remember that on that graph that I showed you, about half of children, or young women in this case, 3 years after they started being sexually active, had acquired at least one serotype of HPV. Well, chances are they have not acquired all 4 serotypes of HPV. And so the vaccine will be effective against any HPV serotype that the child has not yet contracted. So you're maybe less effective if the child has already been exposed, but you're still going to have a positive effect. I hope that answers the question adequately.
I have another question. We've heard from a couple people that, maybe just one person, that the public health office kind of prioritizes ages in kind of the ideal age range, and then is not giving the vaccine to older adolescents. Is that true, or have you heard that?
I've heard something like that. The vaccine is best given before someone is sexually active. So it's licensed down to age 9, and so you can give it. If you think a child's going to be sexually active prior to age 11, give the vaccine at age 9. Not sure how you'd know that, but it would be a good thing to do. It is best given before somebody's sexually active for the reasons I mentioned. So it's recommended at ages 11 and 12. But catch-up should be done after that, up to age 21 in boys and up to age 26 in girls, or young women. And I don't know if the state health department trying to keep its vaccine for, its expensive vaccine, for those who need it the most or will benefit the most, has some such limit. I don't know. Any other questions? Sounds like no. Silence.
I don't see anybody typing at
An
this
electronic silence. All right, we'll go out there and vaccinate.
Before we hop off, I just want to mention one thing. On the registration page where you registered for this webinar, there's several handouts, some that Dr. Chilton developed, one that Dr. Chilton developed, and a couple that we've developed as part of the SHIP project here, and some of our student employees worked on. So I would encourage you to take a look at those and please use them as you see fit in your clinics.
Well, to you who have already written, thank you, and to the rest of you, thank you as well. Pleasure talking with you, and I'm available. I think my address and so forth are on the Adolescent Vaccine Toolkit that's part of the handouts that McCain was mentioning.
Thank you very much. And we will go ahead and sign off if there are no further questions. And if anybody did join and was not able to say their name or type their name out, I will remain on for a few more minutes and be taking the chats and write you down if we're here. So thank you very much, and we'll be signing off.